Johnny not done, Kuyala, Johnny not done, Kuyala, women not done, Kuyala, Johnny Nayan, Kuyala, Johnny Nayan, Kuyala, really not done, Kuyala, not done, Kuyala, women not done, Kuyala, Johnny Nayan, Kuyala, Kuyala, Kenny Nayan, Kuyala, Kenny Nayan, Kuyala, Kenny Nayan, Johnny Londonia, Coco, Willie Kumbala, Johnny Ingrandia, Kumbala, Johnny Londonia, Kumbala, Kenny Londonia.
In the previous program, we looked at healers who exerted a miraculous touch. They cured, or claimed to cure, by virtue of some spiritual power which flowed, more or less involuntarily, from their hands. Well, in this program, we're going to look at expert healers. Here, in the heart of industrial Britain, and at the opposite ends of the world, in the heart of tribal Africa. The Sudan is the largest country in Africa. It extends nearly 2,000 miles from the Muslim north to the equatorial jungle in the south, and it includes an enormous variety of tribal groups. For many years, it was a British protectorate, and for that reason, many of these people became the subjects of early anthropological study. And one of the first groups to be looked at were the Azande in the south. In the early 1920s, a young English anthropologist called Edward Evans Pritchard came to live with them and shared their life to a remarkable extent. He shared their food, he went hunting with them, participated in their recreations, and learnt their language. Well, before long, he noticed what was for him a rather peculiar attitude to misfortune and illness. He noticed that the Azande tended to blur the distinction between the two. Now, it wasn't that they failed to see the difference between, say, a broken granary or a crop failure on one hand and, say, an injured foot on the other. But as far as they were concerned, both types of misfortune had the same cause. It was the result of people rather than things, personal malice on the part of friends, neighbors, or relatives. Now, according to the Azande, this malice operated in one of two ways. It was the result either of witchcraft or else of sorcery. Now, in the West, we tend to use these two terms quite interchangeably, but Evans Pritchard noticed that for the Azande, they were quite distinct. Now, a witch was someone who was born with a witch organ. This was a large cyst, which they claimed could be found at post-mortem attached to the underside of the liver. And apparently, when the witch became angry with someone, the cyst or witch organ enlarged, it heated up, and broadcast its malignant influence abroad. And the witch had no control over it. It was quite involuntary. And it was that distinguished it from sorcery. Now, a sorcerer was someone who could skillfully manipulate potions, incantations, spells, and medicines for the express purpose of causing injury, illness, or misfortune. The identification of witches and sorcerers is usually made by consulting the Benga, or poison oracle. Like any other oracle, this is a way of solving mysteries by asking questions in a yes-no fashion. In this case, the old man has administered a strychnine-like poison to a chick. At this stage, it's simply a test to see if the poison works at all. Grasping the chick between his toes, The old man murmurs magical encouragements while he drip-feeds the trial dose, inviting it, as it were, to prove its effectiveness by killing the chick. In all magical procedures, there seems to be a special value in performing them on the boundaries or margins of ordinary life. Even before he could start this, he had to prepare himself by abstaining from fish, from red meat, and sexual intercourse. The chicken dies. The poison is effective. The oracle is ready for use. Evans Pritchard reported this 50 years ago, and when I went to the Sudan, I half expected the oracles to have died out. But within 3 days, several old men offered to show me exactly how they worked. The local chief had arranged for the skills of a witch doctor to be demonstrated as well. Although the villagers were at first embarrassed to admit that anyone now made use of such techniques, as soon as it was known that skilled practitioners were in the area, the local population flocked into the village. It was almost as if a mass X-ray unit had paid an unexpected visit to a city suburb. So all sorts of hopeful sufferers and plaintiffs converged on the jungle clearing. One young man, John Kaziner, had walked 12 miles for diagnosis of his swollen face. The witch doctor is a diagnostic expert, a doctor who finds witches. And he finds them by consulting his own imagination, which is stirred into action with a frenzy of dancing and drumming. He also has to observe a fixed procedure and can only practice after a long apprenticeship. He too must prepare and purify himself, and unless he wears a proper uniform, his diagnosis will be invalid. Even the rhythm of the drums has to be at exactly the right tempo. And has he found anything out about John Casino?
Yeah, the fight doma vle kin pa bi mo ana.
Wo gu sate. Ba mata sangwari nga tambo ha.
Ani ma pegule.
Aiwa. Wa yani ka da kwane. Me ta dinga go borodu. Ene bangire. Wala ta. Na kai na kurapa ya watar. Ah.
He said that during his dancing, he found nobody here who was bad.
He's gone.
He doesn't see an every eye here, or this man who is making war and other things. Everybody here are all right. John.
The witch doctor apparently could find no cause for John Casino's illness in this village. So Chief Andrea called for John Casino to come and tell his own story. How old is John?
John might be around 35. He's still a younger man. 25.
Did it happen very suddenly overnight? I mean, and did he wake up one morning with it big like that, or did it come on very slowly?
John.
His condition was obviously very painful, and I found myself lapsing into the Western mode of medical inquiry by asking questions about the physical cause of the facial swelling. And then what happened after the tooth was aching? Did it come up on one side first of all, or was it always on both sides at the same time with the swelling?
Ya bona chato na nene wata dugu linjiro ku bonisa na awaka.
Sawa ku bonisa.
But it started with one side. Then it come again and join another.
Spread right around.
Spread to another one.
And he hasn't had a fever with it. He hasn't felt hot all over and really sort of ill and weak.
Ya ze wagipana mangalo zale na mangalo wata duko tolo kidunga aduni jazala wata aduni rurungura ha. Gale he sometimes feels cold and he sometimes even feels very hot.
Yes. When he touches it, does it hurt him?
Ya bona wa muna wakachewa le. Kazada ha munai mai gan. He said when he touched it is really painful.
It still hurts.
Yeah.
When it first started to swell, what did he think was the cause?
Ocha tonola nile gugono go wejiwi. Ma bone cha muki awe gukozare nduhenge gine. Gukoze ne foro le begine.
No, but brother.
He said when it starts him first in February, he thinks that it is from the Azande.
From his people.
From his people. His people are the Azandes.
Yes. Well, apparently, when this young man first became ill, he consulted the Benga oracle, the poison oracle of the chicken. And the chicken oracle, when asked questions, proved that this was the second of Evans Pritchard's two categories of misfortune caused by sorcery. That's by someone making bad medicine, and not by mangu, which is the witch organ, which is completely involuntary in its effects. He then consulted a witch doctor, like the young man you just saw dancing, and the witch doctor also proved the same thing. He made the same diagnosis, which, as it were, was the second opinion from the Benga oracle. And the witch doctor also said that this was the result of sorcery or bad magic, rather than mangu or witchcraft, which is an organ inside the belly. Well, now, I think that what this young man has is a septic inflammation of the salivary glands, the ones which get swollen up in mumps. It sounds as if it spread from bad teeth. Now, I think that we could treat this with a Western antibiotic, but one doesn't want to interfere just simply frivolously, so one would have to do it through their system. So we'll have to consult the Benga and see whether, in fact, the Western medicine will be as much help as the medicine that he has locally here. I have some medicine, some pills, which I brought from England, which I think might help John Casino.
Yes.
Now, could you ask him to ask the Benga whether the pills that I have would help him at all? If you could ask him.
Yes.
Sene foro.
Okay, for Casino. For John Casino. Kwa bata. Benga idea. Kwa bata ngaya. Benga kimi bilikona.
Anakini wajibu wanikuruni kinejinga niwene.
Aiwa. Utari majoru ni tupa jikumbale.
Tupa ukumbale.
Tupa Casino.
Ngakoti.
If the chicken dies, it means that the pills will help him. If it lives, they won't. Once again, there was the ceaseless recitation, this time including a rhythmic repetition of Kazina's name. For those who practice magic, words are physical instruments, just as X-rays and scalpels are for us. They cause things to happen, and the skillful mastery of these spells and techniques are held in very high esteem. In spite of the fact that so much care had been taken to test the poison, the old man seemed to be completely unconcerned that this chicken was twice the size of his test sample.
Kazina kikindi benje mwenu Abramu ka fuwa fuko Kazina kikindi benje mwenu Kazina kikindi benje mwenu Kazina kinga tewe ka jangwana me ka fuwa fuko konuko na mbaleke benje pole bota ko benje muje ni ku kondole itege ngwa safuka ine ka fuwa wene ngwa fuko benje muje jeti ki kondole ine ka fuwa ngwa fuka na benje muje ni akate.
So what is
it will live.
It will live, will it?
Yes, it will.
So that means that my medicine won't work.
Well, that means that your medicine will do nothing for him.
It will do nothing for him. Will it do any harm to him if I give him the medicine that I've got? Will it actually do harm to him?
How can
or
we
would he would have to ask the Benga again for that. wouldn't he? Yes, I see.
Jingo.
Oh, no, it doesn't matter to do
No,
that.
he's bringing another...
Oh, no, it doesn't matter.
It doesn't matter?
All I have to know is that my medicine won't help.
He doesn't know.
Well, apparently what has happened is that the chicken has lived, after all. It's not going to die. So that means that my medicine is not going to work.
Oh, yes.
You see, if I had asked him and the chicken had died, then apparently
Then
my
your
medicine
medicine
would have worked. So that's one in the eye for English medicine. The Benga is the most important of a number of oracles, although not all of them involve the use of an expert. The Dapper, or termite oracle, can be used by anyone, rather like a thermometer. Inside this heap of hardened mud live the local termites, whose life is periodically interrupted by having two sticks, one sweet and one sour, thrust into their nest. The Azandi warn the termites that the sticks are coming, and the insects are invited to nibble one or other of the two sticks in order to choose between one of two alternative questions which are then put to them. Here, the essential feature is the lapse of time. The skill is in reading the result and in knowing which stick has actually been nibbled. An oracle like this is used to decide things like the best place for planting next year's crops or the most profitable day on which to mount a hunting expedition. Like tossing a coin, it's a heads or tails result. And while we only make occasional use of such hit-and-miss guidance, the Azandi will not take important decisions without consulting one or other of these oracles. The third and most familiar oracle relies on the same principle, although it produces a much quicker readout. This is the Iwe, or the rubbing board. And again, we have to ask it questions in a yes-no fashion, because that's the only way it can supply answers, by doing something which makes a distinction between the two questions that you offer. So we'll have to invent some sort of question and ask it. Now, I'm going to ask the rubbing board if the film unit and myself are going to be home by Christmas from the Sudan, whether we're going to be back in England by Christmas. And will the rubbing board tell us if we're going to be back in England in time for Christmas?
Muneka baiwa tipoiwa duyeli nga ineke kagwali
Kane binga yo balewe ya. O tika manga yo. Ika pepe yo. Ye binga la kumbata balewe te.
on sticks.
Ne bore mun ne kale. Ino ko pika.
Ya mun pape ko kurwa.
Ino ko pika.
What he does, he rubs this little piece of wood up and down on the other piece of wood, and moves backwards and forwards, and he asks it questions, and then if it sticks...
If it sticks, that's good. He said, no, you will not reach England. Something may happen to one of you on the road, on the way. It doesn't stick. It means that nothing will happen to you.
Oh.
When it sticks, it means that everything is all right. So you reach in peace.
Ina gana gusura rana ne koyo.
He moistens the surface with water.
With water.
But he also uses a piece of root.
Yes.
Now, what does that do? What is that for?
That means to stick and to make this...
Makes it slippery.
Makes it slippery.
But does it have magic in it, that root? Does it do something
Jamu
special?
kungwale katumonji kula pa bale fakina watu kina kungwale wodu.
Tidule.
Kina gai wodu te.
Kina gai wodu sa. Ina bakina yi wasanani. Ya linga alite. Ya linga alite. Ina bakina yi
It is
wanani.
not to be eaten. It is especially for that.
It is specially for that.
It makes it to speak the truth.
It makes it speak the truth. I see.
Gena ikipine. Ungia kitu kumpata giza gbendi gwanga ha. Ya kiga kuinga niyo ya kiteki patara ni koyo. Kini ya bayra na me kumunga pukon.
That's what that is the stick. Have we got a result yet?
Yes.
Has it said peace or?
Yes, it said peace.
Oh, that's very good to know.
It said that you will reach in peace.
Thank you. That's good old rubbing board. Thank you very much indeed. The everyday tasks of a Zandi life are fraught with the possibility of accident and misfortune. If, for instance, a well-made granary inexplicably falls down, witchcraft or sorcery are immediately suspected, and the oracles we've just seen would be called into play. The Zandi are skillful potters. Even without the use of a wheel, they can shape a perfectly symmetrical vessel. But if this pot were to crack unexpectedly in the kiln, the craftsman would immediately suspect malice, just as much as if his face had swollen up unexpectedly. The oracles which he would use to identify the culprit and the magical procedures which he would use to frustrate them rely on totally different principles to this obvious craftsmanship. In craftsmanship, as opposed to magic, the shape of the outcome is visibly determined by the quality of the materials and by the movements of the craftsman's hands. Everything else is irrelevant.
Monsieur Nantubo.
Well, now, what are we to make of all this? Now, to most people, the behavior of the Azandi would seem irrational. To attribute all illness or injury to witchcraft or sorcery might seem absurd. Well, we might want to argue that we should throw it all out because it doesn't work. Well, that's not quite so easy. The point is that our criteria of success and failure simply don't apply to the Azandi. For them, magic is something which accompanies every aspect of life. For them, it's as natural as breathing. Just as we throw salt over our shoulder or avoid walking under a ladder, so they have productive and protective rites which accompany every single one of their important daily activities in order to ensure their success. So naturally, the onset of illness automatically raises suspicions of witchcraft and sorcery. So perhaps the protective magic doesn't work. Well, there's always a standby explanation. Perhaps the rituals weren't observed in the right order. Possibly the person didn't abstain from red meat or from sexual intercourse. Perhaps one of the villagers came too close to the Benga and vitiated its power. In any case, no single episode of failure can do anything to undermine the overall belief in magic as a whole. One of the things that Evans Pritchard found, in fact, was that the idea of magic and witchcraft and sorcery was so all-pervasive, so total, that there was no way in which he could prove to his Zandi hosts that they were wrong.
I have often been asked whether, when I was among the Azandi, I got to accept their ideas about witchcraft. This is a difficult question to answer. I suppose you can say I accepted them. I had no choice. In my own culture, in the climate of thought I was born into and brought up in, and have been conditioned by, I rejected and reject Zandi notions of witchcraft. In their culture, in the set of ideas I then lived in, I accepted them. In a kind of way, I believed them. Azandi were talking about witchcraft daily, both among themselves and to me. Any communication was well nigh impossible unless one took witchcraft for granted. You cannot have a remunerative, even intelligent conversation with people about something they take as self-evident if you give them the impression that you regard their belief as an illusion or a delusion. Mutual understanding, and with it sympathy, would soon be ended if ever it got started. Anyhow, I had to act as though I trusted the Zandi oracles, and therefore to give assent to their dogma of witchcraft, whatever reservations I might have. If I wanted to go hunting or on a journey, for instance, no one would willingly accompany me unless I was able to produce a verdict of the poison oracle that all would be well, that witchcraft did not threaten our project. And if one goes on arranging one's affairs, organizing one's life in harmony with the lives of one's hosts, whose companionship one seeks, and without which one would sink into disorientated craziness, one must eventually give way, or at any rate, partially give way. If one must act as though one believed, one ends in believing, or half believing, as one acts.
Morning, Dr. Zedek's reception. Would you like to come in at 10:25?
It's very important that I see Dr.
Yes,
Stone.
No, it's a week today that she's due to see Mrs. Ryan. Good morning, Dr. Stones. Can you bring him down to the surgery? 9:30 tomorrow. Why, what's the matter, love? 2:15 on Tuesday. There's no chance of you coming in, is there, Mrs. Buckley? Let them dissolve on the ulcer. Yes, it's all right, I know what they are. Are they dystalgesic? Are they torpedo-shaped? Right, thank you.
Can I have Mrs. Bond's prescription?
6,000 miles away from Africa, in a small industrial town in Lancashire, people fall ill in much the same way. Like the Zandi, they regard physical illness as something which they'd rather do without. Most of these patients, like their African counterparts, would have treated minor ailments on their own, using simple remedies obtained without the advice or authority of an expert. But when the illness is serious or prolonged, they also seek specialized help.
Well, I'll see if he can take you on. His list is pretty full.
I have tablets.
Yes. What tablets are they, do you know?
Tablets.
Have you got your bottle?
However, there are important differences, and they're not the obvious ones which strike the eye, like the fact that this medicine is conducted indoors in cubicles furnished with phones, desks and carpets, or even that this place happens to be equipped with gleaming technology.
Doctor, it's Sister on Ward 12 of Christie's about Mr. Buckley.
For the African, unlike the European, medicine is only called into existence when the occasion demands it.
At all? No. Well, I'll see if he'll take you on his panel, but I know he is full. So,
And they'll do so I get the tablets.
yes, well, you see, they're all full. This is the problem. Anyway, sit down and I'll see what we can do for you.
Mrs. Walmsley.
Mrs. Walmsley. How are you, Mrs. Walmsley?
The would have came in last night, but she was in hospital.
Now, Jim, let's have a look. First of all, would you like to take this off for us? And,
The experts to whom these patients are coming share a body of wisdom which is constantly being tested by standards of success and failure, which are shared, discussed, and explicitly stood by.
That's not too bad. All right. Now, put your head right back. As far back as
The most important assumption in Western medicine is that each disease is a process, and that it has an actual physical existence,
Stomach, I've got this coming on my stomach, it's going bigger every day.
and that some of these processes can declare themselves with signs and symptoms which might not seem serious in themselves. Well, this is one, though not, of course, the only reason
That's all right.
why Western patients are perhaps less stoical than their African counterparts.
It was the same in Bolton. I got the same problem. I had to go there in the end.
You can try the other doctors.
I think it's a waste of time. They'll all say the same thing. That's it.
Very sorry.
I'm getting in contact with Wigan.
Yes, okay.
Right.
Bye. Yes. The doctor's list is full. He can't take you. Well, do you want to try the others first? Do you want to try the others? All right, try the others, and if not, come back and doctor will see you as an emergency. That's Stone's reception.
For us, it may be the expert who recognizes that something is wrong in a person who believes himself to be healthy. A medical survey caught this man, and when an unsuspected abnormality was detected in a routine blood sample, he found that he had automatically become a patient without having a symptom to complain about.
I'm trying to untangle these so they're not crossing over one another.
The Azandi would find it very hard to understand the concept of having an illness without being aware of it.
That's fine.
And the thought of consulting an oracle like this without apparently having a problem to put to it would seem quite unintelligible. But of course, Dr. Stone's oracle works on an altogether different principle from the ones which are used by the Azandi. The ECG, for one thing, provides information about the patient's body rather than about his social relationships. And since the machine doesn't vary, records taken at regular intervals can be profitably compared.
You can compare the feelings here.
To the miles of your own.
And as you can see, there really is no difference. And you see V4, you see it's virtually the same shape, and there's no change in the ST segment, and there's no Q wave. So I was able to reassure him strongly that we weren't, in fact, getting the ischemic heart disease. In fact, he came here on his bike, didn't he?
Yeah.
To have his ECG taken.
For the Western physician, illness is a process in time. It's not just an episode. Illness has a biography within the life of the patient. So there's always something to be learnt about it by following its progress at regular intervals, even when the patient is apparently healthy.
Hello.
This may involve the doctor pursuing the patient, an idea which the Azandi would find incomprehensible, perhaps even frightening. Mr. Topping is an 87-year-old ex-miner, and he's been one of Dr. Zadik's patients for more than 30 years.
Are you still coughing a lot?
No.
Just to bring any...
No
stuff, no blood up from your chest, no, good. Breathe in and out.
He suffers from pneumoconiosis after 50 years of breathing in coal dust.
Well, I think that's quite clear now, Mr.
Yeah.
Now, and what about your arms? Can you lift them at all? Because you're
For us, medicine is a continuing search for improvements in performance and well-being.
That's better. Can I get you to pat your bottom?
Yeah.
That's a lot better, isn't
They're
it?
improving, yeah.
Done? A lot better. And then what about the left arm?
My right arm's worse.
Yeah, they're doing very well. Now you can go out now, but I'd like you to up in the surgery about a week's time or so.
Yeah.
I want to examine you again. So
Yeah.
just check again that there's nothing.
I don't feel any trouble, man. I only this. You see,
Yeah.
these arms.
I think you're looking very well. I think you're back to normal again now, aren't you?
Yeah, I think so, anyway.
What do you think, Mrs. Totten? Do you think
Oh, yes, he is much
Is
better.
he eating again?
But, yes, he's eating well now.
I'm eating well, yeah.
But what he has, he'll have to put up with that arthritis.
Oh, I'm afraid so, yeah.
These blue scars on your head are from being down the mine,
Yes,
are they?
yes, yes.
You've got them all over your
Yeah.
hands, yes?
all over my legs, too.
Yeah.
Really? How long were you down the mine for?
53 years. 53 years.
Things have changed a great deal from the early days down the mine, haven't
they're
they?
having a good time now, you know, really.
Right.
Good one.
And you got trouble with your chest from working down the mine,
Yes.
did you? Yes.
A 40% pneumonicosis. Often battle is worry, you know, for keeping your health.
Mm.
If you worry, you're soon be gone. You see, you have to keep your own best side and don't worry about anything, really. But my missus worries, I don't worry. And music like she is, she can touch your toes without any trouble. At her age. Huh?
How long have you been married?
52 years. Oh, 62
62
years.
years.
62 years.
In a long lifetime, a Western patient can accumulate a fat volume of medical history. And such records are an essential prerequisite of accurate diagnosis. One illness may affect the course of a later one, and several separate symptoms may represent the continuing development of one disease. In Britain, these records will pass from practice to practice as the patient moves home.
Yes. If you'll just fill there for me, please. Yes. Thank you very much. Now, if you'll just take a seat, I'll call you in one moment.
Now that Mr. Sidlow has been accepted onto the register, his records will follow him here in a few days. But until these credentials arrive, he is, in a sense, a medically stateless person.
Notes are a way in which you can hand over to someone else in your absence, and is a good way of recording a lot of actual data so that you can look down the line and you can see what has happened to that patient over a period of, say, 3 or 4 years in respect to weight, blood pressure, and various other things which you've measured, which are important in determining how the disease is developing or how it's changing.
So I could say, in fact, that one of the things which had actually altered the prospects of a modern patient was not so much new drugs or new treatments, but the new conscientiousness about his past.
It may be absolutely crucial to your eventual assessment of the disease to know what you thought the first time the patient came, because he may very well have forgotten. And I've, on many occasions, been able to make a diagnosis, not on the basis of what the patient remembers, but on the basis of what my notes tell me I thought 6 months before. And in many diseases, for example, take multiple sclerosis, it's only the episodic nature of the illness, and it's the changes in your physical signs as you go along over a period of perhaps 6 months or a year, which tell you that you're likely to be dealing with something like multiple sclerosis.
Anne Matthews, can you go down and sit on the blue chairs, please?
By the end of the day.
So, unlike the Azandi, the prospects of these patients depend on the fact that the doctor is familiar with their medical past and is able to assess the significance of what they're complaining about in the present and can step in at just the right moment and exert a specific effect upon their future.
Well, let's have a look at you, Margaret, shall we?
For Margaret Heaps, swollen ankles and breathlessness were the first signs that something was wrong with her heart. And when Dr. Stone found that she had a faulty valve, he was able to call in other experts who replaced the inefficient part with a plastic substitute.
If we could just have a look at your scar. How many weeks is it now since the operation?
Well, it's a month today since I came out, and it was a fortnight before.
Nicely healed. Good. What does it feel like to you? Does it feel any different? Are you aware that there is a foreign piece of material?
Only when I'm in bed.
And what do you hear when you're in bed?
Tick-tock, tick-tock.
It's like a ticking sound, is it? Right, we'll just listen to it and see how it's behaving itself.
The first stage in the cure was to replace a faulty heart valve.
Can you hear it clicking?
Since the operation, her progress has been closely monitored by Dr. Stone.
It obscures all the other sounds. Would you like to have a listen, Jonathan?
It's the first time I've ever heard one.
I like you sit aside.
Thank you very much indeed. Yes.
You're doing very well today, Mark.
I know. I've never had as many men in my life.
It's quite cosy. This was... Well. How about that then? Her obvious well-being would lead the Azandi to regard her as cured. But Dr. Stone's physiological knowledge compels him to prescribe an elaborate regime of pills, and Mrs. Heaps will have to continue taking some of these for the rest of her life.
All of these and see what we're
we'll count pills.
Well, there's one drug which is to try and prevent aggregation of platelets.
So this is to stop the clotting?
That's right, yes. It's not a true anti-clotting thing. That is the warfarin.
So that's
so those two things are, in a way, acting on the coagulation system. One against platelet aggregation.
So that's really just simply to keep the blood fluid and
that's
stop
right.
clotting, yes?
These are just iron.
So that's to prevent
well,
anemia.
the fact that she became anemic after the operation,
yes.
and this is just to help her build up her own iron stores again over a period of time. Those are just to relieve any pain or discomfort.
Yes.
And that is digitalis, to control the heart's irregularity and keep the rate down to a reasonable level. That one is a diuretic to prevent overloading of the system by too high a blood volume.
Yes, so that's to keep it. This arsenal of pills may look like an unwarranted interference with nature, a meddlesome dabble with the body. But since the body is made up of chemical processes, we can go a long way towards reproducing these if and when they fail. But Morris, it's a perfect example, that, of seeing someone whose human personality has been restored by treating them as a mechanism.
Oh, indeed. It was the dreadful thing was to watch her gradually deteriorating as a person. As she became more and more ill, and then to see her restored not only to the way she was a little before the operation, but to the way she was years ago. She looks 20 years younger now than she did before she had the operation. And you can see the obvious joy in her face and the relief. Because I'm quite sure she was also convinced that she was going to die in the weeks preceding the operation.
For all the technical resources of Dr. Stone and his colleagues, what really makes the difference between the sort of medicine that he has to offer and what's available in Zandiland is the fact that Dr. Stone is always interested in the possibility that he might be wrong.
Pop that underneath your tongue, will you? Close your mouth now. That's right.
When you hear a story like this, with the neck stiffness and the headache, then you're going to try and exclude something like meningitis as the first thing. But the fact that the story had such a strong respiratory element to it, with a cough and so forth, led you to think that this was a virus infection in the lung.
Yes. Now, if it had been a bacterial type of meningitis, there would have been a pretty rapid, progressive decrease in his general well-being. If it had been a lymphocytic choriomeningitis or another viral type of meningitis, I would have expected by this time that he would have had very obvious neck stiffness, so obvious that it would have been clear that there was an inflammatory lesion in the meninges with enough positive signs for me to make a diagnosis. But in fact, none of these things were true. And the large respiratory element, I wouldn't have said excluded the possibility that he had a meningitis. And if 24 hours later in fact, he had been worse, the neck stiffness had been greater, and there'd been perhaps even a little clouding of consciousness, then I would have sent him into hospital.
So that apart from the quality of the signs themselves, the way in which each of those signs behaved in time is really one of the most important aspects.
One
of
of the most important factors in any form of diagnosis. How long have you had it? And how has it changed since it started? Is it getting worse or is it getting better over time? How rapidly is this happening? The more acute the illness is, the more important that may be, because you may have important decisions to make. A decision, for example, of whether an operation is required, or whether certain investigation, such as lumbar puncture in this case, is necessary in order to make the diagnosis. Also, you're always aware of the possibility that your original diagnosis may be wrong. And if it's wrong, you've got to monitor the situation daily in order to see whether it's wrong, because if it is, you know what is likely to happen. And if something happens which tells you that you're on the wrong track, then you can backtrack, change your view, and take the appropriate action. Look straight at me. That's right.
Here, Dr. Stone is not just examining the patient at random. He's testing a series of hunches or conjectures, and he's looking for evidence which will count for or against each one of them. Not finding something may be just as important to him as finding it.
Yes, he has a little pharyngitis still. He's had that all the time. But that's very common, of course, in respiratory infections, and is almost universal in the upper respiratory. Now, I'm just going to flick ahead, as I did before. Let it rest on my hands, that's right. You see, you've got a very good range of movement now.
Flabby neck, yeah.
Yes. Would you like to sit up and put your head on your knees, as you did before? That's right. Get down as far as you can go. Yes, well, that's fine. Very good.
Now, he couldn't do that.
No, he couldn't get down quite as far as that. But he wasn't so stiff that he was just sort of sitting up straight and couldn't get any further.
Which is what it would have been if he'd had meningitis. There would have been that sort of rigidity.
If it happens in children, they actually cry. If you get them to move beyond a certain point or try and push them gently, it actually makes the headache much worse, of course. They increase the intracranial pressure. The combination of a respiratory illness with a high fever and a headache always makes one think also, of course, of a virus pneumonia. And very often, physical examination of the chest reveals nothing if you've got a patch of pneumonia which is deep inside the lung, and you just can't hear it at all, and very often no physical signs, and only by doing an x-ray of the chest will you find the source of your infection. I've been caught out by that once or twice.
Well, I remember the first high fever I saw as a young houseman was a young man coming in with a high fever and a cough, and I simply couldn't find any physical signs, and I just was totally baffled by it. And then 3 days later, on the x-ray, one suddenly saw this little patch in the
Did he have a headache too?
And he had a headache, and stiff neck, and the whole thing.
The whole point of monitoring such of this, of course, is to discover whether any changes occurred from the last visit, which may, in fact, be completely masked, may not produce any symptoms, but may give you a clue to the original diagnosis. Breathe deeply. Out. Breathe. Out. Breathe. Out. Breathe. Out. Breathe. No, that's fine. Very good. Right. Lie down. Now, just relax your tummy muscles and just take a deep breath now, deeply as you can.
You're feeling for his
spleen, yes. Yes. Because quite a number of viral infections, of course, give rise to splenic enlargement and, of course, to lymphadenopathy too. The lymph glands will also become enlarged. Breathe deeply.
Yes, if this were the fever of a glandular fever, you might expect to feel a large spleen.
And even the liver, of course, may become enlarged.
Yes, so you're feeling for the liver now?
Yes.
And you'd feel the liver coming out like a sort of ridge underneath the ribs there.
That's right. The edge would slide beneath this rib margin, which you can see here, and would come up against my fingers. Take a deep breath. Out. He hasn't, in fact, had anything which suggests that his kidneys would be involved.
So you're now feeling for the kidney by bringing the kidney up from the back.
That's right.
And into the feeding hand.
You should be able to feel the kidney on this side, of course. As the liver descends, the kidney will be pushed down. Now take a deep breath.
The reason why the prospects of this patient are so different from those of John Casimir is that his physician sees beneath the surface of the personal situation, and visualizes not malice or witchcraft, but an interconnected system of organs and processes. I came here to Zandyland almost 50 years after Evans Pritchard, and was surprised to find that the medical practices which he reported had hardly changed at all. In the same period of time, the medicine in the industrial towns of Lancashire had altered almost beyond recognition. Although it's now fashionable to assume that there is some neglected wisdom in primitive medicine, that magic, herbs, oracles and spells acknowledge some valuable mystical unity in nature which Western medicine has arrogantly overlooked, the fact remains that Western medicine has a future and Zandi medicine only has a past.